Are you looking for professional training in forensic mental health?
My name's Steve Hart, and I'm a professor of psychology at Simon Fraser University. My background is in clinical and forensic psychology. My area of specialty is violence risk assessment and management. And it's a pleasure to be with you today. We're here today basically to talk about violence triage. These are the kinds of questions that professionals will ask themselves as part of their work. When am I legally entitled to conduct a violence risk assessment? Or when am I legally entitled or required to take extraordinary steps to manage violence risk? We think about this in the hospital. A patient gets admitted from psychiatric, as in a psychiatric emergency unit or acute care unit. They just walked into emergency or were taken in by police or family members, and now we got them. Do we put them in segregation or not? Here's another one that comes up a lot in hospitals and also in criminal justice settings, like with police. Who should I conduct a violence risk assessment of first? There's a case of a guy who was in a relationship with a woman, and the woman, she was unhappy with his jealous, controlling, possessive behavior, and told him that she wanted to break up with him. He became angry and aggressive and threw things at her. She phoned the police. He gets arrested. He gets given a no contact order. He was unhappy about the no contact order and wanted to get back together with her. And she's now moved out, living in a new place and trying to get her life together and feel secure. And then she gets up in the morning, and in her apartment building, which is a nice secure apartment building, in her apartment on the kitchen table is a jelly bean. Jelly bean, her favorite candy. He always used to give her candies. She's getting in her car in the mornings to drive to work. There's a jelly bean on the front seat of the car. She goes to work. There's a jelly bean on her desk. Now, I ask you, is this violence or is this not violence? When someone or something triggers that potential concern, it may be necessary to search for obvious warning signs of violence. Anytime somebody says something, does something, or you learn about something that makes you wonder, that makes you potentially concerned, we need to be able to use a process to triage. What are we going to rely on? Well, we're going to rely on a process called violence triage. This is the general process. We're going to review reports. We're going to identify warning signs. We're going to sort, prioritize, and plan or respond. And then we're going to document.
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.